How many types of diabetes do you know? Diabetes type 1. Autoimmune disease. The body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. As a result, the body produces little to no insulin. Insulin is a hormone essential for regulating blood sugar levels. The cause of this autoimmune response is not fully understood, but it's believed to involve a combination of genetic and environmental factors. These patients need lifelong insulin therapy. Diabetes type 2. This is the most common form of diabetes. The causes of type 2 diabetes are multifactorial, involving a combination of genetic and lifestyle factors. The body's inability to use insulin effectively is known as insulin resistance. Over time, the pancreas gets exhausted and starts to produce less insulin, leading to higher blood sugar levels. Risk factors of diabetes type 2. Obesity. Excess body fat, particularly around the abdomen, is strongly linked to insulin resistance. Physical inactivity. Lack of regular exercise contributes to weight gain and insulin resistance. A diet high in processed foods, sugary drinks, and unhealthy fats can lead to obesity and insulin resistance. Age. The risk of developing type 2 diabetes increases with age, especially after 45. Management of type 2 diabetes. Managing type 2 diabetes often involves lifestyle changes, such as improving diet and increasing physical activity, and maintaining a healthy weight, along with medication or insulin therapy if necessary. Gestational diabetes. The type of diabetes that develops during pregnancy and typically disappears after giving birth. The exact cause of gestational diabetes isn't fully understood, but several factors contribute to its development. Hormonal changes can lead to resistance to insulin, leading to higher blood sugar levels. Insufficient insulin production. As the body's insulin demand increases during pregnancy, the pancreas may struggle to produce enough insulin, resulting in gestational diabetes. If left unmanaged, it can increase the risk of complications for both the mother and baby, such as high birth weight, premature delivery, congenital heart defects. And the mother is at high risk of developing type 2 diabetes later in life. Maturity onset diabetes of the young, MODY. Unlike type 1 and type 2 diabetes, MODY is caused by a single gene mutation that affects insulin production. Family history. MODY is inherited in an autosomal dominant pattern, meaning if a parent has MODY, there's a 50% chance their child will inherit the condition. Early onset. MODY usually develops before the age of 25, regardless of weight, lifestyle, or other common risk factors associated with type 2 diabetes. Mild symptoms. MODY may have mild symptoms or no symptoms at all, which can lead to underdiagnosed or misdiagnosis as type 1 or type 2 diabetes. Genetic testing is often used to diagnose MODY, especially when there is a strong family history of diabetes. Management of MODY. Management of MODY varies depending on the specific gene mutation. Oral medications, while others may require insulin therapy. Diabetes insipidus, DI. An imbalance in the body's water regulation leads to excessive urination and intense thirst. It is not related to other forms of diabetes, and it doesn't involve blood sugar levels. Causes of diabetes. Insipidus. It occurs due to problems with the production or response to antidiuretic hormone, ADH, also known as vasopressin. ADH is responsible for controlling the body's water. The causes are generally categorized into two types. 1. Central diabetes, insipidus. This is the most common form and occurs when the hypothalamus, a part of the brain, does not produce enough ADH or the pituitary gland cannot release it properly. Cause of central diabetes. Insipidus includes head injuries, brain tumors, brain surgery, or radiation. 2. Nephrogenic diabetes, insipidus. In this type, the kidneys fail to respond to ADH properly. Causes of nephrogenic diabetes. Insipidus include 1. Genetic mutations affecting kidney function. 2. Chronic kidney disease. 3. Certain medications like lithium. Symptoms of diabetes. Insipidus. Excessive thirst, polydipsia. Excessive urination, polyuria. Nocturia, dehydration. Treatment of diabetes. Insipidus. Addressing underlying issues is the best choice. For central diabetes. Insipidus. Desmopressin. Nephrogenic diabetes. Insipidus. Medications, diuretics, such as hydrochlorothiazide or amiloride, can help reduce urine output in some cases.